Welcome to Dr. Balaga's God Knowledge Doc podcast, your quick dive into the latest medical breakthroughs to keep you ahead of the curve. Let's get started. This article is based on a JAMA clinical guideline synopsis on vitamin D for prevention of disease. It was updated on April 23rd, 2025. Vitamin D, lots of hopes, but narrow proof. Low vitamin D is linked to respiratory tract infections, cardiovascular disease, malignancy, and metabolic disorders. There is no universal threshold for supplementation. Widespread use persists without testing. This guideline focuses on prevention in healthy populations, not for those with malabsorption, renal disease, or osteoporosis. It was based on the recommendations from meta-analyses by the Endocrine Society. These trials range from children to older adults and pregnant women. Typically in children, 1,200 international units a day. There was a reduction in respiratory tract infection. Difference is about 4.3%. In adults above the age of 75 years, the dose used was about 900 international units per day. There was a mortality risk reduction of around 6%. In pregnant women, they used higher doses, 2,500 international units a day. There were missed outcomes. The confidence intervals were wide. In pre-diabetics, they used 3,500 international units a day. And there was prevention of type 2 diabetes. The risk difference was about 2.4%. So key findings: all conditional supplementation advised for children, the elderly, and pregnant women and those with pre-diabetes without routine testing. There is no recommendation for general population screening. Vitamin D is low cost, low risk. Potential benefits may justify empirical use in specific groups. Most randomized controlled trials show wide confidence intervals, underpowered endpoints, or heterogeneous methods. And there's equity concern. There's higher deficiency in blacks, Hispanics, and Asian populations. Future research is needed. Long-term trials in deficient populations, race-specific outcomes, and optimal dosing strategies. If you enjoyed this episode, share it with your colleagues. When we change how we see disease, we change how we shape lives. Until next time, stay curious, stay compassionate, and keep seeking wisdom. Podcast brought to you by Master MedFacts at mastermedfacts.com.